have direct offers around funding. So we have a medtech accelerator, which is for innovators from the Eastern region. We focus that around clinical entrepreneurs. So if you are a clinician and are working closely with clinicians and have an innovation, it's very much early stage, and you want some proof of concept funding, you can receive up to £125,000 proof of concept funding through the medtech accelerator, and there's information on our stand about that. If you're seeking and or thinking that you're going to need larger sums of money, and some of the biotech diagnostic products clearly need quite a sizable sum in terms of investment, you might be interested to know that we run SBRI Healthcare, which is a national innovation programme where you can secure up to £1 million of innovation. £1 million of investment to support the development of your innovation. SBRI allows companies to keep their IP and isn't a match funding programme, so it's particularly popular with SMEs, and we focus the way in which it works to support the co-development of solutions from SMEs to address needs that the NHS is currently struggling with. The way in which we work primarily with companies, as I say, is to offer a range of support along what we describe as an innovation pathway, but we run a series of readiness events, learning opportunities effectively, pretty much one a month, which set out some of the challenges, some of the intricacies of the NHS requirements, and they're free to anyone to attend. The next one is in Cambridge on the 2nd of October, but we have them pretty much every month, and colleagues at those events will set out for you a little bit more detail around different parts of the NHS structure and expectations, and you can also book one-to-one surgeries, so if you've got specific bespoke needs, or you want to connect into particular parts of the system, then through the surgery offer we can walk you through some of the challenges you might be having and connect you in. And then we also have a range of information leaflets. We've got some online tools that again help people to navigate their way through the NHS. Fundamentally, and I think our people in the room have already brought products to market, have got products that they're trying to sell into the NHS. Barry has, I know. Others, yeah. So it won't be any surprise for you guys to know it's really difficult. It is really difficult, and I don't want to put people off, but fundamentally people talk about the NHS as one entity. It's hundreds of different business units and different decision-making processes, each of which have different drivers and different needs around what products and innovations they're wanting to support. So inevitably, making sure that you have the very best evidence, be it clinical, be it health economic, be it the user experience, will be vital. And certainly if you're thinking of taking your products into the NHS, you will need to have a really strong case around each of those pieces of the puzzle, depending on where you're impacting. Clearly, if you're offering an IT system that's helping manage the flow of patients, then your clinical evidence won't be required. But if you're wanting to provide a tool to support someone in surgery, then clearly understanding what impact it would have in terms of the clinical would be critical. So I would definitely encourage people to think very carefully about the evidence that they have. Increasingly, the NHS is looking for real use case evidence as well, so not just lab-based or data search, or even, to be honest, just even peer-reviewed publications now are not sufficient to be able to support adoption. You need real use case examples and tested environments, and I guess that's where the academic health science networks come into their own. We are Eastern's AHSN, but there are 14 other partners across the whole of England, and we can connect you with those, and we can help you find those test environments. So if you need to have a specialist connection to oncology, then through our partners in London, it might be that we can link you up to the Royal Marsden and the leading centres in Manchester and so on, if that's something that would be of value to you. Equally, we can help you understand the needs in the NHS. It's very difficult to work out sometimes. We think very easily about, oh, well, my product's going to save people's lives or it's going to help them manage their conditions. But sometimes it's not very clear in the NHS who would actually buy that product, because the purchasers sit in a variety of different situations. So the hospitals will buy some elements of activity, the primary care, the GPs buy others, and understanding where your purchaser is really vital. So very definitely you need to marshal your evidence. Your evidence needs to match both economic and health considerations. You definitely need to understand who your buyer is and understand who the beneficiary is. So sometimes the beneficiary is not the purchaser, but having some connection between the purchaser and the beneficiary is something, again, the academic health science networks can support you to do. And then finally, there is a little bit of serendipity, a little bit of direction of travel. The political wind often drives innovations along certain agendas and certain areas of focus. We've got a drive at the moment across the breadth on atrial fibrillation and trying to detect early detection around strokes. People who've got solutions around AF detections and or the management of stroke. I'm not saying it's an easy path, but we're significantly on the hunt for you. So definitely, there's a prevailing wind around AF detection. There's also very strong focus around mental health solutions. So you'll have seen in the media, there's a lot of challenge in the mental health system. Like the rest of the NHS, they're struggling in terms of volume of need and then a mismatch of being able to service those. So ways in which we can support people with mental health conditions is something that we're very, very strongly hunting for and looking for at the moment. A local company, only last week I saw ASO, who have received funding in one of the in the SBRI programme, received, I think it was about £18 million of investment, and they've got an online CBT offer which has gone very effectively in the NHS because it can support people to self-manage in a reputable and thorough and appropriately evidenced way, and certainly solutions like that are very popular at the moment in the NHS.